Welcome. Today, we're delving into a common yet often unspoken health concern: anal fissures. These small tears in the lining of the anus can cause significant pain and discomfort. Understanding what they are, why they happen, and how to treat them is key to relieving the suffering they cause. So, let's get started on unraveling the mysteries of anal fissures. So, what exactly causes these painful tears? The most common culprit is straining during bowel movements, often due to constipation or passing hard stools. However, chronic diarrhea, inflammatory bowel diseases like Crohn's disease, and even childbirth can also increase the risk. Less frequently, anal fissures may be caused by infections, anal sex, or underlying medical conditions. It's important to remember that anyone, regardless of age or gender, can develop an anal fissure. Let's dive a bit deeper into how anal fissures develop. The tear typically occurs in the posterior midline of the anus, which is an area with relatively poor blood supply. This limited blood flow can hinder the healing process. When a tear occurs, the anal sphincter muscle, which controls bowel movements, can spasm. This spasm further reduces blood flow to the area and perpetuates the cycle of pain and delayed healing, turning what might have been a simple tear into a chronic problem. Anal fissures are a relatively common condition, affecting individuals of all ages. While precise figures can be difficult to obtain due to the often private nature of the problem, studies suggest that a significant portion of the population will experience an anal fissure at some point in their lives. They are particularly prevalent in infants and young adults, but can occur at any age. Importantly, they affect both men and women equally. The symptoms of anal fissures can vary, but the most common and often most distressing is sharp, stabbing pain during and after bowel movements. This pain can last from a few minutes to several hours. Other symptoms include blood on the toilet paper or in the stool, a visible tear or crack in the skin around the anus, and itching or discomfort in the anal area. Fear of pain can lead to avoidance of bowel movements, which, unfortunately, can worsen constipation and perpetuate the problem. Diagnosing an anal fissure is usually straightforward. A doctor can typically diagnose it with a simple visual examination of the anal area. A digital rectal exam, where the doctor inserts a gloved and lubricated finger into the anus, may also be performed, but this is often avoided due to the potential pain. In some cases, if the diagnosis is uncertain or if there's suspicion of another underlying condition, the doctor may recommend a colonoscopy or sigmoidoscopy to further examine the colon and rectum. Anal fissures are typically classified as either acute or chronic. Acute fissures are recent in onset, usually lasting less than 6 weeks. They often heal on their own with conservative treatment. Chronic fissures, on the other hand, have been present for more than 6 weeks and are often associated with a thickened skin tag, called a sentinel pile, near the fissure and spasm of the anal sphincter muscle. Chronic fissures are less likely to heal without more aggressive treatment. Treatment for anal fissures aims to relieve pain, reduce anal sphincter spasm, and promote healing. Initial treatments often involve conservative measures such as increasing dietary fiber, drinking plenty of fluids, using stool softeners, and taking warm sitz baths. Topical anesthetics and corticosteroids can also help to relieve pain and reduce inflammation. For chronic fissures that don't respond to conservative measures, stronger treatments like topical nitrates or calcium channel blockers may be prescribed to relax the anal sphincter muscle. In some cases, surgery, such as lateral internal sphincterotomy, may be necessary to permanently relieve the sphincter spasm and allow the fissure to heal. Preventing anal fissures primarily involves preventing constipation and avoiding straining during bowel movements. Eating a high-fiber diet rich in fruits, vegetables, and whole grains is crucial. Drinking plenty of water is also essential to keep stools soft and easy to pass. Regular exercise can help to promote bowel regularity. Promptly addressing diarrhea and avoiding prolonged sitting on the toilet can also reduce the risk of developing an anal fissure. The prognosis for anal fissures is generally good, especially with prompt and appropriate treatment. Acute fissures often heal completely with conservative measures. Chronic fissures may require more aggressive treatment, but most people eventually experience relief. Recent research focuses on improving non-surgical treatments, such as newer topical medications and minimally invasive procedures, to reduce the need for surgery and improve healing rates. Further research is also exploring the role of gut microbiota and inflammation in the development and persistence of anal fissures. Remember, if you're experiencing symptoms of an anal fissure, don't hesitate to seek medical advice. Early diagnosis and treatment can significantly improve your comfort and quality of life.